Hiccups. Hiccups are a recurrent reflex myoclonic contraction of the diaphragm with a forceful inspiration associated with laryngeal spasm and closure of the glottis, producing a characteristic sound. It is mediated by the phrenic nerve and vagus and thoracic nerves. Gastrointestinal, pulmonary, and cardiovascular symptoms and signs may be present. Carcinoma, achalasia, and hiatal hernia are common pathologic causes, as well as intrathoracic distension, pulmonary or pleural irritation, pericarditis, mediastinitis or mediastinal mass, intrathoracic abscesses or tumors, and aortic aneurysms. CNS causes are many, including metabolic, acetonemia, uremia, drugs, sulfonamides, infection, encephalitis, hypothalamic disease, also associated with yawning, tumors of the fourth ventricle, and cerebral vascular disease, vertebrobasilar insufficiency. Idiopathic and psychogenic hiccups are common. Treatment is usually not required. The hiccups tend to be self-limited. They may be intractable, especially if there is a primary cause, in which case the underlying cause is treated. Drug therapies for intractable hiccups include phenothiazides, valproic acid, phenytoin, carbamazepine, benzodiazepines, and baclofen. Surgical sectioning of the phrenic nerve or selective vagotomy is occasionally required. And those are hiccups. Have a great day.